Welcome, everyone, to episode 9 of the Total Relationship Podcast. I'm Kim Cochenour, the COO at Form Wealth Advisors, joined by my co-host, Tyson Ray, the CEO at Form Wealth. Today, we're talking about a new card in the Discovery deck set. It's health and healthcare, because there's a real connection between health and wealth, and we want to make sure we hit that well with you today. Your clients will have significant health effects in their life that make a big difference. And so we really want to be able to dig into that and why that matters, that you be in the middle of that conversation with your clients. So let's jump in.
So I'm having one of those moments that you're just crotchety and mad, and we're talking about the card that comes up about health and healthcare. So I thought I'd take my blood pressure here we'll see how this goes while we're in the middle of a podcast, because, self-help, are you taking care of yourself first? Because it's hard to try and help others take care of themselves if you're not taking care of yourself. So,
you need to take a few deep breaths while you let that blood pressure cuff run, or
I don't
what
know.
will help you?
No, it's kind of exciting to find out, how high it can go.
Oh, great. I'm glad we have this documented for everyone.
Right. Unfortunately, my golf score and my blood pressure keep going in the wrong direction. Maybe that's correlated. But look at that, 135 over 90. That's a little high, but not too bad. As I'm drinking coffee and on a podcast and running around, technology didn't work. All right. So this is where, again, the cards, people, this is in the concern section of the cards, and people will have put in front of us, they would have communicated to us that this is an issue.
They pick it, right?
Yeah.
You let them pick. They'll have that. This comes up for a reason for them. They're not just picking it out of nowhere. It matters.
Yeah. Yeah. And somewhere in this, I want to hit on or come back to the fact that in our review, so this is the boarding process of a client coming in discovery and trying to understand how we're going to work together. But for every client that we have in the review process that we go through, the health and health care is one of the top sections we start with after kind of family, because people will sacrifice their own health to care for others that they love. And once they're done doing that, okay, now how are you? All before we get into whatever the meeting's about, again, because if someone's health has changed, the entire purpose of the meeting probably should change, especially if it's a major health issue.
Yeah. Well, they're not going to hear anything you have to say if you're sitting there jumping right into their portfolio and they themselves or a family member of theirs has just had a serious medical diagnosis. You have to start with the heart stuff first, because people will tune you out.
Well, I think they're not going to hear anything you have to say when you tune into the portfolio, period, because that's what they hired the advisor to take care of. So this card comes up, and it's on one side it's health and healthcare, on the other side it's some questions to kind of clarify what does this mean to them, and then it's really complicated. I'm like, this is so scientific. You ready, Kim? We ask, what does that mean to you? Why is that there?
Earth-shattering, Tyson. That's earth-shattering.
Yeah. And then you just start listening, and you're going to find out what health issues they have or they're worried about for themselves or those that they love. You may find out, because it's health and health care, for a lot of people that want to retire before 65, one of the important planning points of that decision is how health coverage is going to be covered. And is the company going to cover it? Are they going to have private coverage? Are we going to have a gap between spouses and loved ones? How we're going to have coverage, and what's the plan? Some people take a different job or go work, part-time or a different career stress job to get healthcare coverage. They have all kinds of money, but for whatever reason, the psychology of paying $1,000 or $2,000 a month for healthcare.
Well, they've gone their whole career not paying it. That's a huge shift in their mind, let alone the shift of pulling from their investments to pay for anything.
Yep. We're also trying to figure out in this, and it'll be flushed out, what if they're past 65 or they are retired, where are they at for turning on Medicare? What type of Medicare do they turn on? Do they have supplements? What does that look like? We often let them take whatever time and express their feelings around the cost of healthcare or the quality of healthcare. And then a little bit, because this is trying to make their life better, a little bit is also kind of a prodding question of what are you trying to do to help make your life or your health? What are you trying to do to make your health better? and be able to encourage them, whether it's pickleball or going for a walk or being active or the gym or the personal trainer. I've had a couple different clients over the years that we encourage them. No, we'll send you an extra couple $100 a month to pay for the personal trainer and go have those personal training classes. Because for me, which I have a personal trainer, I pay them in advance, and I feel like psychologically they owe me then the training session, because like I would never want to pay them individually, like I'd stop going. But if I pay in advance and then they owe me the sessions, then I go.
A total
uh,
different mind shift.
yeah, yeah. And the agreement with the personal trainer is like, if I schedule it, don't show up, charge me anyway, so it's like a penalty.
Mm-hmm.
uh,
Yeah,
and the whole
that works for some people.
well, it's like the whole idea of in creating a system for you to figure out how to take care of you. And an advisor's job is to be an encourager. An
Yeah.
advisor's job is to understand, through these questions, will find out, somebody has type 1 or type 2 diabetes, and how is it going? And, a way to show care is that occasionally if information's coming across our desk about something new, and one of them was an insulin pump that was a new thing a decade ago, members, sent them the link, and it was just like, hey, I'm connecting and I care and I'm paying attention. I know this matters to you. Or, a lot of times when we find out that there's a life-threatening health issue or diagnosis, being able to help process the feelings behind that, try and understand the treatments behind that, understand what the costs and the finances are going to be adjusting to help care for that, or if the person's having to work or not work, and all the financial planning then that maybe comes after that.
Yeah.
But it's
Well,
so
and
important.
Tyson, it creates a space for clients to have that conversation that's not as emotionally loaded as when they're sitting down and talking about a healthcare crisis with their children. They're not in their doctor's office trying to process it. They're in a safe place. It's a privileged in that advisor's safe space for the client to be able to share those things and kind of flush some of that stuff out, because you're an invested party, but I can see where the client views it as a great neutral, safe space because you've built a great relationship over time for them to be able to dig into that there and know that you're there to help them plan for it.
Yeah, and so the cards are designed to flush out again, what are the health issues? Are there health issues? Are there health scares? Are there things within your family that you're worried about? Uh, and then the health coverage. And then, like I said, uh, in our annual review process, it's second to the family category is, how is your health? Any updates there?
Yeah.
And again, I think too many advisors are not taking advantage of the opportunity to just do a checkup, literally,
Mhm.
because they're too excited to go talk about the portfolio or think that's where all their value is added, versus realizing that if someone has a health scare or a health event, and as much as I try and remind clients, like, hey, let us know how it's going or what's going on in your life, uh, it's kind of 50-50 to whether or not they'll give us a heads up, or the spouse gives us a heads up that the stroke happened, the heart attack happened, the cancer diagnosis happened, the treatment started. But because now we're having this review, we're asking that question on the front end, and it allows us to get to put what's most important first, right?
Yeah.
Instead of trying to lead with, your car, your vacation, your cash flow, your bank balance, maybe what the portfolio is doing, which I think too many advisors start there. It's starting with what really matters, which is your family, and then how are you doing?
Yeah.
Um,
So, Tyson, one of the things I think that's helpful here is providing examples of where you've made a mistake and you've learned from it. So, in an instance where you wish you would have actually led with a health question, or a time that you felt like it was a win that you led with the health question and kind of changed things, I'd love for you to share an example of where you learned from this, from maybe not asking the right question.
Thankfully, I was a quick learner on this one, and I don't remember. It was early in my career, and I don't remember um, what client there was, but it was like I was calling, uh, and I think this was back in my career when we were still trading stocks to be bought and sold, and I was the apprentice, and I was calling, Kim, to basically say, hey, we got X number of shares that the analyst is saying to sell, and I just need your permission to sell them, and we'll swap them to ABC. And it was kind of like, I can't talk right now. I'm like, okay, well, should I call you back? And I don't know. And it was like literally like the spouse just got taken away in the ambulance.
Oh my goodness.
I can remember, I can remember another time in my career that literally I had to get, gosh, he was probably in his mid 70s and he was probably a good 200 pounds, and he fell in the bathroom.
Oh goodness.
And that's how I found out he's having stability issues. And it's just like, because I had to go in there and
Wow.
help get him up. And it's just like it's just like these are people first,
Mhm.
and not portfolios, and not dollar signs, and not things to kind of play with, or again, I just it's um and I think there's an empathy thing too, of just like, the women that I've walked with where they've gone through breast cancer, and just the vulnerabilities of that, and being able to just be able to be an advocate of like, how are you doing? How are the treatments going?
Mhm.
Um, I'm also mindful of, because we start with these questions, we can get on the front end of a diagnosis that can be fatal or cannot be ideal. One that comes to mind was a client that basically she was having liver failure, and in like late 50s, and she was like the healthiest little thing. And they tried what they could try, but basically the diagnosis that she ended up getting was she had maybe 2 to 3 years to live, and she was the breadwinner. And basically we sat down and had an honest conversation about how much did they want to count on the diagnosis of the 2 to 3 years.
Mhm.
And
Yeah.
it was agreed that, yeah, that's probably what's reality. And we made the decision together of, hey, let's let you retire now. Let's let you raid. Who cares about taxes? Raid literally your 401k savings, which was what they were going to retire off of, and spend the money that was down, spend down the money that was in that account. Because if your prognosis, and you're quite certain that's probably what your time frame is going to be, we have this life insurance policy that we took out that was going to last probably a decade beyond the
Mhm.
2 to 3 years, and that will
Backfill
uh,
what they could spend in that
backfill
time.
what you could spend. And they did. They went and traveled for about a good year while she still could, and then they tried to. They went and lived somewhere warm for a good portion of the year, that second year. And when she passed, and I was at that funeral and embraced the spouse, it was. That's what success feels like, quite frankly, in the industry. It's not making more money. It's not building an index. It was just helping people live the life, and give them the freedom to basically like, hey, this doesn't make any sense, but
Mhm.
you can do, like, this is a different way of doing it. Like, here, go,
Yeah.
like, quit working. You're the breadwinner. Well, we can take income from here. It's gonna last maybe 3 to 5 years, and you have 2 to 3, so that should work. And if you then are passing and this insurance is on you, it backfills it. And um, as I talk to that surviving spouse now to this day, it's like the gratitude he has for the fact that they had that time together. And I think
Yeah.
it allowed her to pass with peace, knowing that she was able to kind of, while she could and have the energy, go enjoy some things and have that time.
Yeah.
None of
Well,
this
and
happens had I not started with, hey, how are you? Because
yeah.
that's what flushed it out. It's like, well, I kind of got this
Yeah.
diagnosis.
Well, and that's part of why it's part of the discovery process, but also the ongoing relationship. And you don't have to be a health expert to start providing advice to your clients around their health and healthcare planning. That's what you're there for, is you're there to listen. I think you said in another episode, you have to ask the question and then just shut up and let the client answer and listen to what they have to say. They'll tell you how to lead them where they need to go with your experience, but you have to be quiet and let them speak and give them a place to speak.
Yeah, and where these cards get to play off of each other is, again, on the other cards that we talked about for retirement and income. If retirement goal is an age, and I want to be done at 55, for example, uh, this healthcare card is where we're going to go flush out. Okay, we said over here you want to be done at 55. So how are we covering insurance costs from 55 to 65? And have you thought about that? And what does that look like? Um, and healthcare is just a really big, it's a big expense in retirement. It is definitely something that costs more every year.
Oh,
Um, and
absolutely.
people's health changes. for
Yeah.
better and for worse. And so it's
Yeah.
something to monitor. And I think more than it's something to understand what the change is, monitoring it uh, within that relationship. So if nothing has changed there and the foundation is set within the family and set within how they're doing, now we can progress into the finances and the other aspects of planning.
Yeah. So as a highlight some of the questions that are on the discovery deck cards, are there any health concerns or issues that are going to affect your future, and what should we be planning for? How is your current health insurance covered, and who does it cover? And are you concerned about the rising cost of healthcare is going to affect your retirement? So we've added that card into the discovery deck over on totalrelationship.com/discovery deck, so you can get the PDF download on that. Tyson, remind us a little bit more in depth the value of the discovery deck with prospects and then the ongoing relationship with our clients. It's the biggest point of why we use this day in and day out.
I think we haven't gotten there yet, but when we get there, I think the fact that when we come back after having this discovery meeting and we show the clients the notes we've taken on the family and the pet's name and the health, and you're going to work until 65 and then turn on Medicare, or you're going to work till 60 and then the school system is going to pay healthcare till you're 65. Like, we're listening to their answers. You don't have any health concerns, or you're a cancer survivor, and it's just knowing what those issues are. Help flush out and build the trust that becomes foundational, so we can speak into their lives and try and make their lives better. And again, on the review, on the annual review standpoint, it's just as simple as like, hey, how you doing? Any changes to your health? And when you find out, because this happens all the time within our practice, when you find out that the knee's getting replaced or the hip's getting replaced or they're having a surgery here or something there, that's the opportunity where we get to send a little gift, a little blanket, a little recovery. For crying out loud, for most of my career, when I didn't have a lot of money, I just sent a little instant bag of chicken noodle soup when they were sick, that basically a little note said, "I'm bullish on your recovery." And it got laughs, but it was like, hey, we care and we're paying attention and we're listening. And then to the clients that, it's like, okay, well, how's the knee? Because 6 months ago you had it replaced. How's it going? Do we have to have the other one done? Or the client that has the chronic back pain, but plays golf, I'll start the meeting with, how's the back holding up for the golf game? Because we
Yeah.
know, and people live with this stuff, and it's just like, hey, sometimes getting the aches, and sometimes just being able to communicate the aches and pains and the struggles of life is what this total relationship is all about. This is what people do within families, with friends do it together. Parents and children do it together. And I'm just simply realizing, like, hey, an advisor can do this with a client and add value in doing it, and do their job better by knowing it.
Yeah. They're better for it. And the relationship with the client is better for it. Um, so, Tyson, is there anything else as we wrap up today you want to make sure you leave our listeners with?
You don't have to have empathy, and you don't have to add emotion into any of the answers to health and healthcare issues. Just asking the question and taking in the information. So I'm not asking people to care in ways that maybe they're not wired to care. I'm also not saying that, hey, if you get real excited about this stuff or you have a lot of empathy built in, you might want to guard that a little, because it's not a matter of trying to it's the trust of not prying so far into the depths of the things that the clients are dealing with. But at a very high level, uh, if you're not feeling well, or if you've gotten a diagnosis that changes your perspective of how long you're going to live or what quality of life you're going to live, that should be part of the understanding of an advisor to do the planning for your future. And that's why I think an advisor should lead with those questions instead of being surprised when they find out what the diagnosis were, when the clients start changing their pattern or behavior. And it doesn't have to be a surprise. It's something that we can just as simply ask, just like we ask all these other questions, to try and build that relationship.
That's great. Thank you for tuning in to episode 9 of the Total Relationship Podcast. If you haven't already, click follow or subscribe to be the first to know when we have new episodes available. New episodes are available every other Tuesday. If you're looking for a place to get connected with a community of like-minded advisors, head on over to LinkedIn and follow the Total Relationship page. You'll see Tyson and I over there. Until next time.